Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great. How are you?
Well, you know me. I am living it up.
Well, that's good news. And you have even tons more energy in your voice than last week. And next week you'll have tons more. Very exciting.
That's right.
That's right.
I do everything backwards.
Well, we have a lot of listeners here on Living Pain Free that are living with chronic pain in the realm of orthopedics. That's also known as musculoskeletal pain, which includes muscle pain, joint pain, tendon pain, ligament pain, disc pain, back pain, knee pain, hip pain, arthritis pain, carpal tunnel syndrome pain, tendinitis. You might have stiff joints, dull aches that you don't know what the cause is. So write this number down. Give us a call during this hour. You can speak directly with Dr. Darrow about your pain at 866-870-5752. That's 866-870-5752 right here in the studio. And Dr. Darrow's website is replete with tons of information. You want to check it out at www.lastemcells.com. That's www.lastemcells.com. And the big surprise is you get a free book when you call the show today, and it's Dr. Darrow's latest called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. It has 264 scientific studies, and a lot of you call and you've never heard of this kind of treatment, regenerative medicine, and this is where you can find lots and lots of information. So call and get your free book, 866-870-5752. And we are here Saturdays at 10 a.m., again at 1 p.m. And if you go to the website, you can email Dr. Darrow off of every page on the site, and you can see him performing the treatments on videos. And the site again is www.lastemcells.com. So that's all I know today.
I know a joke.
Oh, boy, a joke. Go for it.
You know why I want to tell a joke? Because I love listening to your laugh. So a man and his wife are dining at a table in a very plush restaurant in L.A., and the husband keeps staring at a drunken lady swigging her drink as she sits alone at a nearby table. The wife asks, "Do you know her?" And the man says, "Yes, she's my ex-girlfriend. I understand she took to drinking right after we split up 7 years ago, and I hear she hasn't been sober since." "My God," says the wife, "who would think a person could go on celebrating that long?"
I did not expect that. That's hilarious.
So I got and this is not a joke. I've got I get emails, Nita, you know this, and people who know me and who listen to the show and my patients all know this. My website, which is www.lastemcells.com, has a spot on every page to email me. So I get emails all day and all night long, and I answer them any time I get a chance between patients when I wake up in the morning, really up till midnight when I go to sleep. And this is a terrible one that just came in, and it came in yesterday at 4:47 p.m. So I track these things. The person says, "I had a rotator cuff tear in my left shoulder. My doctor said I needed a shoulder replacement. But I had a right shoulder," that's the other one, "replacement in 2013. I now have severe pain in that shoulder and my doctor thinks the hardware has loosened. He'll know for sure after I have a CT scan. I don't know if I need shoulder revision for my right shoulder. That's the one that was replaced, right? In either case, would stem cell therapy be more beneficial than traditional shoulder surgery? I'm 67 years old. Thank you. Well, that person knows the answer because they already had a failed surgery. I luckily had a failed surgery in my right shoulder when I was in medical school. And I say luckily because, I loved my professor who did it for me. I was doing orthopedic surgery at the time. And he was a great guy. And the surgery was a success, but I didn't come out good. You hear this all the time. The surgery was a success, but the patient died. Well, my shoulder blew up like a balloon, and I had a high fever afterwards, and it never went back to being its normal, miserable shoulder that it was with the injury I had weightlifting. But I did heal that shoulder with regenerative medicine, and today we use platelets and stem cells for that. Back in the day, we didn't have that technology. But I did heal it after one treatment. I injected myself at night, woke up the next morning completely pain-free and full range of motion. So I was lucky. My surgery was a failure, but I didn't have a shoulder replacement. All I had was a surgery to cut part of the acromion off. That's the top of the shoulder, the bone that comes from the scapula in the back. And it was called a decompression. Well, I never needed that decompression. And a major ligament was cut also to open up the shoulder, but it got worse. But my luck was that I had never had a shoulder replacement because those fail all the time too. I tell this story all the time on the radio. A man came in with right shoulder pain, and I said, lift your arms up. And he said, well, I can't lift my left arm. That's the one that he wasn't complaining about. He was complaining about pain in his right shoulder. And I said, why is the left shoulder immobile? And he said, well, I had a shoulder replacement there a few years ago, and it doesn't move anymore. And I said, why? He said, the prosthesis of the humerus part, that's the arm bone, doesn't fit into the shoulder part, the glenoid part. So am I going to tell this person who sent this email they should get a shoulder revision after the replacement failed?
No.
I don't know. I don't think so. Or am I going to have them do a shoulder replacement on this other shoulder just because they have pain? I don't think so. And I get people in all the time ready for a shoulder replacement, and one of their friends literally pushes them to come into my office to see if regenerative medicine using platelets or stem cells could work. And I don't know of anybody who got a shoulder replacement after these treatments because it is such an effective way of healing the body. It can be done anywhere, literally from the head down, to the neck and shoulders and the muscles and the elbows and the wrists and the fingers. A lot of people have finger arthritis that we take care of. They're ready for a joint replacement in the finger or thumb when that doesn't need to be done really. And then down to the low back and the hips and the greater trochanter and the knees and ankles and toes and whatever. We can inject any of those things. So if you're thinking about getting a surgery, please, please, please think twice. A lot of these surgeries, I would say 50% of them fail. That's my experience. And I don't mean to anger the surgeons because I do love the surgeons. They do hard work and they do invasive work that has terrible side effects, and they have to take the brunt of the doom and gloom from that. So they're great guys, but too many surgeries are being done today that don't need to be done now that we have stem cells and platelets, or what we call PRP. So think twice before you get a surgery. I know a lot of people listening right now are considering a surgery because they have joint pain or muscle pain, tendon pain, ligament pain. And it's just falling away by the wayside. More and more people are learning about it, and doctors are switching from orthopedic surgery to doing regenerative medicine. In the courses that I go to, there's a lot of orthopedic surgeons learning about how to do this now. So please be safe. Surgery is very invasive, and what I do is very conservative. People don't get hurt from it. So I want to give out the phone number right now to the studio so you can talk to me live. And the number to the studio is 866-870-5752. I'm going to repeat it while you grab your pencil. That's 866-870-5752. And if you want to reach me at the office or you want more specific information, there are people by the phones at the office right now. And that phone number to my office is 800-300-9300. I'll repeat that one again for you. That's 800-300-9300. Don't be shy. You can use an assumed name or say it's about a friend or a family person, because I love to talk to you guys on the radio. It's a lot of fun, and I like to think on my feet. As a lot of you know, I was a lawyer for 15 years before I went to medical school, and we got trained on what they call thinking on your feet. And it's a lot of fun being in court and having the judge say something like, "Counsel, I don't care what you studied about this case. I have my own theories on it. Would you please tell me about my theories?" And it's something you don't seriously, it could be something you don't know anything about, and you have to think on your feet and please that judge.
Sounds like you have to also mind read him a little bit, too.
Well, yeah. Law is a lot of fun. Medicine is a lot more fun because healing is something that is just an amazing thing. And I marvel every day at the successes. We don't get to heal everybody. I'm going to say that. Regenerative medicine works on the majority of people, but there are some people that fails. And usually it's because they don't do enough treatments. They think it's going to be a miracle. And it can be for a lot of people where it's an overnight success, but mostly it takes a few treatments to get the healing that you need to get. So I tell people when they come in, don't look at me like I'm a healer. I'm not a healer. I just do a treatment that heals if you stick with it. The other thing that fails people is that they think they can go back to their sports the next day and not rest the area. The area needs to heal because what we're doing is we're literally growing back the tissue.
Absolutely.
How long does it take to grow tissue? Well, it's different for everybody. Everybody heals at their own pace. So you've got to listen to the doc. Too many of my patients cheat on me and then they don't get better.
Explain what you mean by cheating on you.
Not listening, not following directions. And that's typically it's about being too active after the treatment so that you're not giving it a chance to heal. Pretty simple. Or not coming back.
Makes sense.
A lot of people don't come back because they didn't get the success they wanted, and then their surgeon says, that stuff can't work anyway. And then they go get a surgery. So, yeah. May I do another?
Sure. Let me just quickly give the phone number, 866-870-5752. Right here at the studio, you can speak directly with Dr. Darrow. That's 866-870-5752.
So before I take this next question, I wanted to just mention that we do something that I'll call hair restoration in the office, and we get about half women and half men that come in to have their hair regrown. So a lot of people have what's called high DHT, that's dihydrotestosterone, and what that can do is it can actually kill the hair follicles. Some people have low iron that can do the same thing. Some people have low thyroid that can do the same thing. So the first thing I like to do if someone wants to have regenerative medicine in their scalp to grow hair is to get their labs drawn. And you don't have to do that, but it's just another potential key to growing the hair. And we can balance the hormones. Sometimes the estrogen, progesterone, and testosterone are off kilter. And oftentimes, though, it's, men and women both have testosterone and dihydrotestosterone. And if that DHT, the dihydrotestosterone, is too high, we end up with male pattern baldness. And women can have that too. I know that sounds silly because it's called male pattern baldness, but females can get it just as readily as men. So may I take another question, Nita? Or do you have anything else you want to add?
Well, I just want to add that when you call the program today, you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And it has tons of scientific studies that will really explain this very simply and very well to you. And to get that book, all you do is call 866-870-5752. And then you also get to speak to Dr. Darrow. Go for it.
I'd love to hear from you. It's so much fun. All right, so I have a question here. This one says, steel rod in wrist. Well, that's a little scary, huh? That's an email that came in on Thursday at 10:14 p.m. And emails come in from my website at all times of the day and night. We get about 1,000 hits a day on the website from all over the world. And we get patients who come in from all over the world, too. A lot of them come to L.A. for a vacation, you might say. And at the same time, they're getting some sunshine on the beach. In between, they're getting treatments by me. So this one says, steel rod in wrist. Dear Dr. Darrow, I just wanted to say I sometimes hear you on the radio, and I only wish I had known about you some years ago when I needed an operation in my right wrist because of rheumatoid arthritis. I shouldn't say this, but I'm just reading it. I'm not making this up. The lousy surgeon put an end to my tennis playing by putting a steel rod in my wrist. I suspect if I'd gone to you instead, I might still be playing tennis at 81. Keep up the good work. So I don't think surgeons are lousy. I think they're amazing. They do the hardest work in medicine. It's scary being an orthopedic surgeon. Things can go wrong, and like I said before, in my experience, about half the surgeries don't come out very well. So here is someone who most likely could have had some easy injections with a skinny needle. In the wrist, I use a 30-gauge needle. That's like an acupuncture needle. And we spray it with a cold spray first so you don't feel it. I've done it to myself. The first area that I had pain in that I fixed with regenerative medicine was my right wrist. And it was from hitting a golf ball. Actually, it wasn't hitting a golf ball. I was on the golf course, and I wanted to hit a golf ball over a tree in front of me, and I was about 250 yards from the hole, so I used a 3-wood. And I had seen a video on how to do this, where you hit way down on the ball, a very steep descending angle, so the ball goes up in the air. So I tried to hit over a tree, and I know a lot of you golfers listening to the show have had this same type of an issue. Well, I never even really hit the ball. I hit the ground at about 100 miles an hour, hyperextended my wrist backwards, and stretched out the ligaments. Okay? I didn't break anything. It's often better to break a bone than it is to hurt the ligaments and the tissue around it, because when bones fracture, they usually heal well, but then they leave the aftermath of the soft tissue in disarray after that. So this person had a steel rod put in their wrist. What did I do in my wrist? I injected it a few times. That's right, I injected my own wrist. I've also injected my knees with stem cells. I've done my elbows. I've done my shoulders with stem cells. I've had other people do my neck and back, my entire back actually, all of the vertebrae, and I've had all of the ribs. All of my ribs have been injected. I had what's called costochondritis, where every breath I took hurt. And it's been amazing for me. I'm not saying it's a miracle. A lot of people say, I heard you're a healer. I hear this is a miracle. I go, none of those. It's just a treatment that grows tissue and can help most people. It's not going to help everybody, but it helps most people. So I'm going to give out the phone number to talk to me right now at the studio. So get your pencils and get some paper. It's 866-870-5752. 866-870-5752. I have one more statement about this poor person with the metal rod in their wrist. It is still possible that regenerative medicine can help them. So I get tons of people that come in post-surgery with a failed surgery, and we can still help get them better and reduce their pain. Nita, you got anything to add?
I do. While you have that pencil in your hand, why don't you write down the website, which is www.lastemcells.com. That's www.lastemcells.com. You can see Dr. Darrow performing these treatments on videos on the site. You can also email him off of every page on the site. I think that's why you get thousands of emails, because we always say that a lot. So the number is 866-870-5752 right here in the studio. And how about we go to Marina in Tarzana?
Hey, Marina, Dr. Marc Darrow, how are you today? You're talking about questions on regeneration of the hair. Yes, go for it. Ask me.
How long is the treatment? How many treatments do you have to undergo?
You never have to do anything. So let's get rid of the word have to and talk about how many would you want to. You have to.
I have to look good in front.
I'm with you, Marina.
So the first thing we would do, Marina.
Yeah.
The first thing we would do is order some blood labs and find out if you have some discrepancy in your hormones. As I mentioned before, it could be a high dihydrotestosterone, low iron.
Right.
It could be literally about 20 different things that can cause hair loss in men and women. So the first day you came in, I could do PRP or PRP and stem cells on your scalp and get the process going, because even if we found out that your labs are perfect, we can still help you. And how often do I like people to do it? I like them to do it about once a month for 4 months to get started to see if we have any success. If we do, then we like to do it. Then we like to do it about every 6 months to keep it going, because typically if it works, it will stop working if you stop doing the treatment. Not always. Sometimes we can reboot the hair follicles with just one treatment. It all depends. Mm-hmm. Everybody is different. But
right.
I'm so glad you called, because people are embarrassed to talk about losing hair, especially women.
No, I have to get it done because I have to go to a wedding in August, and I have to get it done. Otherwise, I have to wear extensions. I hate extensions. So.
Yeah. Okay. Well, I'd be happy to. If it's for August, I would suggest you come in soon, and you can go to the website at www.lastemcells.com. There's a video there I think it's on me injecting the scalp, and you can see if it's something you want to do. We numb the head beforehand, and
it's not painful.
Are you telling me it's not, or are you asking?
I want to be prepared. Is it painful?
You know what? I'm going to be honest. Some people say they don't feel it, and some people see a needle and run away. So hang on with us, and we'll finish up with you after this quick break.
Okay,
stay
with us, Marina. You're listening to Living Pain Free with Dr. Marc Darrow. Grab a pen or a pencil, write down this important information coming your way. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.